Hey everyone, I want to talk about triggers for atopic dermatitis, eczema. This is one problem that I see quite often with young kids or an older adult that maybe had eczema as a child, but then they quote unquote grew out of it and then it's coming back. And it's very important to understand with eczema, atopic dermatitis, any sort of itis means there's some kind of inflammatory process that's occurring. And what I want to share with you is that the trigger is very, very important to try to minimize as much as possible. So before I go into the study, just want to talk about the trigger and with cases and severe cases with eczema, because those of you that have had it or you have a child with it, it can be pretty bad. To give you an example, my youngest had a pretty bad case of it. He would itch his ankles to the point it would bleed and he'd go hide in different places. So you can only imagine how hard it was for us to watch him. And as long as he didn't itch and then start to maybe break the skin, then that sort of snowball effect didn't happen and that vicious cycle. So we were trying to minimize the triggers as much as possible. And so with this study, it wasn't a randomized controlled trial or anything like that, but there's some information that you can benefit from this study out of the Journal of Dermatology. And what they did was they took a survey of patients with eczema and they wanted to know what the triggers were, what the top triggers were. And within the study, they found that dairy was the number one trigger. So 25% of the respondents said, hey, dairy for sure, it triggers my eczema. The second one was gluten. It was about, I think, 18.9%. Alcohol was pretty close, I think 18%, and then sugar was right around 17 or 18%. So you can see these are dairy, gluten, obviously a child's not going to drink alcohol, sugar. So the top three are the most commonly eaten foods in a lot of our processed foods. Obviously there's good sources of gluten. You have, sourdough bread or better qualities of bread, or you have dairy that could be potentially not a processed dairy. But if you are a person that's struggling with eczema, or in my practice, I've seen that taking out these different foods also helps with any sort of skin condition, especially with acne. And that's the thing, is that with acne, number one go-to would be dairy. If I can eliminate dairy out of someone's particular nutrition, then their skin automatically gets better. It doesn't clear it completely. There might be other issues, but it's one of those triggers that can be very inflammatory to the skin. So just remember, when it comes to eczema or any other sort of skin breakout, hives, maybe itchy skin, again, you want to try to minimize that trigger. Minimize that trigger so it doesn't lead on to exacerbating symptoms, and then you get into this vicious cycle of it being very, very inflamed and then maybe having to take a medication. So hopefully this helps you understand the triggers for atopic dermatitis, eczema. Until next time, eat well to feel well.